Hi guys, my name is Rowan Gosi and this is my population level health education intervention project on alcohol abuse and obesity. Here's a little bit of an introduction. I decided to do this project in the city of North Long Beach. I compared the affluent community of Signal Hill, which is 90815 area code, and the population of North Long Beach, which is 90802. So for this population health level education intervention prevention, I chose to teach the underserved population in the zip code 90802 regarding alcohol abuse and obesity. Just a little bit of some facts and statistics. Obesity is a global epidemic, according to the CDC. Over 36.5% of adults in the US are obese. 17% of children and adolescents are obese in the US. Per the CDC, excessive alcohol use has led to 88,000 deaths and 2.5 million years of potential life lost. Health issues that I identified in the city of North Long Beach. I identified alcohol/substance abuse. Through my windshield survey, I identified that there's a high prevalence of alcohol abuse in this part of the city. This is due to the higher poverty rate and the large number of homelessness in the area. Community residents of the area as well have also verbalized the need for more resources with alcohol and substance abuse. The other health issue that I identified was obesity/nutrition. Through the windshield survey, identified that more residents were obese in this area compared to the affluent community. After interviewing with key stakeholders and community residents, I also identified a lack of education regarding proper nutrition and health issues. The background and significance. So obesity is a global epidemic. According to the CDC, 17% of children and adolescents are obese. The prevalence of obesity is higher in Hispanics. It's 21.9%. It's 19.5% in non-Black Hispanics, 14.7% in whites, and 8.6% in non-Hispanic Asians. Obesity is also associated with poor mental health outcomes, reduced quality of life, diabetes, heart disease, stroke, types of cancer, and it is also the leading cause of death. In the city of 90802, over 25% of seventh graders are obese, 21% are overweight, 21% of ninth graders are obese, and 21% are overweight in the city of Long Beach. According to the CDC, excessive drinking is responsible for 1 in 10 deaths. According to the CDC in 2016, high blood pressure, heart disease, stroke, liver disease, digestive issues, cancers such as breast, mouth, throat, esophagus, liver and colon, dementia, poor school performance, mental illnesses, and social issues have been affiliated with alcohol abuse. It would be important to educate this population regarding alcohol abuse and provide resources regarding cessation. In the city of Long Beach, it has the 4th highest number of unsheltered homeless for the major cities, according to the U.S. Department of Housing and Urban Development. Also, Long Beach has the 9th highest population of homeless with a chronic illness, such as alcohol abuse. The Healthy People 2020 objectives. The Department of Health and Human Services launched the Healthy People 2020. The objectives that I chose specific for this presentation was the first goal would be, and this is in regards to obesity, would be promote health and reduce chronic disease, the consumption of healthy diets, and achievement and maintenance of healthy body weight. The second goal identified in regards to substance/alcohol abuse would be to reduce substance abuse to protect the health, safety, and quality of life for all, especially in children. The needs assessment, according to Pender, Murdaugh, and Parsons, a thorough assessment of health and health behaviors is the foundation for tailoring a health promotion prevention plan. In order to understand the needs assessment of this population, I conducted a windshield survey. I interviewed 8 key stakeholders, and through this, I was able to collect data, and I did some research, and I also interviewed with community members. The theoretical framework and needs assessment. So we conducted the precede and proceed phase. In the precede phase, this is where the assessment and planning happened. I was able to identify social issues in this phase, as well as economical issues, the readiness to learn of this population, as well as environmental factors. I was also able to identify possible barriers that will hinder me from implementing these educational sessions. In the proceed phase is obviously the implementation evaluation. This phase involves implementing the education. This is the part where I actually went out into the community and taught educational sessions regarding alcohol abuse and obesity. This phase also involved short-term and long-term goals that I set, and also whether or not these interventions would be effective. The issues regarding the education and practice, the issues that I found were population needs, obviously financial resources, transportation if they weren't able to make it to these educational sessions, having a higher education. This was an issue with the population in regards to understanding the material and understanding what was being taught. Another one would be support system, whether or not these people had support, employment, a safe environment to conduct these educational sessions. And in regards to obesity, the availability of grocery stores just in that area and how the residents would be able to access them was an issue that I identified. As far as health needs, health education, in regards to what they already know and the type of education they're receiving. If they lacked health insurance, that was an issue, and also a healthcare access, especially the homeless people who often lacked health insurance and healthcare access, and also education about preventative care, such as continuity of care. Many of these people probably weren't continuing medication regimen and having regular checkups because of the lack of insurance, healthcare access, and education. As far as intervention, the first goal, the obesity intervention, according to Healthy People 2020, is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weight. The ultimate outcome that I identified is to educate the community regarding obesity and ways to prevent obesity, especially in the youth. As far as education, I defined obesity, the cause of obesity, and ways to prevent obesity. I educated the residents regarding the importance of proper nutrition, calorie intake, and importance of physical activity. I also educated the residents regarding the health risks associated with obesity, such as heart disease, stroke, cancer, hypertension, and diabetes. As far as technique and formats, I used a PowerPoint presentation. I passed out brochures and pamphlets. I did a survey regarding what kind of issues that the residents identified. I did a Q&A to answer any questions that they may have. And I also demonstrated this was more of an interactive to see if they really got anything out of what I just taught them. Interventions continued in regards to alcohol/substance abuse. The goal per Healthy People 2020 is to reduce substance abuse to protect the health, safety, and quality of life for all, especially in children. As far as education, I taught about the dangers of alcohol and substance abuse. I educated about the long-term health risks affiliated with alcohol and substance abuse. This would include high blood pressure, heart disease, stroke, liver disease, any digestive issues, cancers such as breast, mouth, throat, esophagus, liver, and colon, dementia, poor school performance, mental illnesses, which is very important among the homeless population, as well as social issues. I thought it would be important to educate this population regarding alcohol abuse and also to provide resources regarding cessation of stopping the abuse of alcohol and substances. As far as technique and format, I did a PowerPoint presentation. I also did pamphlets and brochures, Q&A, answering questions that they may have. And this part demonstration, as I did before, was just stay interactive, just to see if my short-term goals were achieved, if the residents of 90802 were able to understand and take from what I taught them. And most importantly, I thought it was key to provide resources and shelters for people who are experiencing alcohol abuse. And this would also include the hotlines available. As far as budget, I didn't really have to spend much for this presentation. I mean, really, I think it was just getting myself to the classroom. I conducted this educational session at the Christian Outreach and Action facility, which is available in downtown Long Beach in the area code 90802. It's this old historical church, and they had a classroom available for me already. All I had to really bring was my computer. A projector was available. As far as printing brochures, which is what I did, I printed these at work, so it didn't really cost me any money. This cost was taught by myself, and I wasn't getting paid for it, so I volunteered, so that was no cost. As far as project evaluation and outcome measurement, overall, I think the two objectives that I set were met. I think the residents were able to identify at least two things that they learned from the education session. As far as short-term goals, I think I achieved this through the residents being able to verbalize knowledge regarding obesity and alcohol abuse. In regards to long-term goals, I don't think I can achieve this long-term goal in such a short period of time. There's a lot of knowledge that needs to be reinforced and continued in order for these goals to be met. And I could do this by continuing more educational sessions and meeting with stakeholders to determine the success of these goals. Results and conclusions, weaknesses or issues I identified was lack of participants. There's a smaller group. There's not a lot of time. If I had more time, I could have reached more people and talked with a bigger group. And also comprehension level, if they were really understanding all that I provided. An example, like a language barrier, as far as weaknesses. Future suggestions that I think would be great for in the future would be simpler education material, more visuals that include videos and pictures in the case that they didn't understand what I was saying, more handouts, and more time for sessions to reach a bigger crowd. These are the references I used. Thank you.